Now back to Inside West Virginia Politics with Mark Curtis.
And welcome back to our final segment this week on Inside West Virginia Politics. Our guest is Democrat Kendra Fershee. She is running in the 1st Congressional District here in West Virginia. I asked your opponent, David McKinley, about what needs to be done with health care in our previous segments. So let's have you address that as well. How do we fix the health care system and improve it in this country?
Well, I think one of the things that we really need in West Virginia, because so many people here work for large corporations like Walmart that don't provide health care, I really think we need universal health care in West Virginia. We have people who've worked, long and hard labor jobs, and they can't get to the doctor when they need to. And I think that that's just wrong when people have worked so hard and have served this country for centuries. So I think we need universal health care. We need to make sure that health care is no longer coupled with employment or age. We need to make sure that everybody who is sick has the opportunity to at least go to the doctor and get treatment. And we need to make sure that people can get access or can get medications that they need in order to treat the problems that they're having. I also think this ties directly into the drug addiction crisis that we're seeing, because that is a healthcare problem primarily, and we need to make sure that people are in treatment, which right now in West Virginia is almost entirely funded through Medicaid.
A lot of the debate about opioid, the issue is, do we focus on law enforcement, do we focus on prevention, do we focus on treatment, or all three? And which, in your case, gets the priority, and what do we need to be doing more in those areas?
Yeah, I mean, I think we've seen it's not a law enforcement issue entirely. We can't arrest our way out of addiction. We can do more in terms of law enforcement and making sure that the drugs aren't coming into West Virginia, because that is, that's a function of large drug cartels that are dumping drugs in the state. And honestly, to some extent, has to do with pharmaceutical companies dumping drugs in the state. But it really is a healthcare issue. In terms of prevention, I think it's a two-track issue mostly. One, we need to make sure that people who are currently addicted have the opportunity to get into treatment, detox, and rehab, and we need resources to fund beds for people in facilities that treatment needs to last long enough, like at least 6 months, so that they can actually get clean. And then the other track is we need our communities healthy. If people aren't able to go home to a good job after they get clean, or they don't have a good job to begin with, they're more likely to be disengaged and go down a path that is not good for them and not good for West Virginia. So people, I think, are mentally and physically in pain, and that contributes to the crisis, and we need to stop it before it starts by getting our communities healthy.
I know one of the other issues you want to zero in on if elected to Congress is education. What would you do differently in education that we're not doing now, and why?
Well, one of the things I think we saw in the teacher strike was that the teachers are not paid enough to keep them here in West Virginia. My campaign platform is that I'd like to fight for your freedom to stay in West Virginia, and a lot of people are not feeling free to stay in their beloved home state. So, one of the things we need to do is make sure that people have paying jobs that keep them here, and our teachers are great. We're such leaders in that regard. So we need salaries that keep talented teachers here in West Virginia. And you can see 4 of the counties in the state that have the highest learning outcomes are also the highest salaried counties in the state, and that really benefits our kids in those counties. So we need the funding. When we're so low, unfortunately, in so many factors, and our teacher pay is one of them. Just adjusting that will go a long way to making sure that we can keep talented people here in their home state.
We are down to our final minute. I just want you to mention your support of medical marijuana and why you think that is not only a health issue but an economic driver for this state.
Well, there are a couple of things. One, it's a safe pain alternative. Medical cannabis is a safe pain alternative to opioids. 2, it's a new revenue stream that the state could absolutely tap into and solve that problem that we have right now in paying our teachers and funding PEIA. And 3, we have the medical cannabis bill, or law actually, here in West Virginia that we can't implement or is hard to implement, in part because the federal government is in the way. So the federal government needs to get out of the way of states that have legalized medical cannabis, and the way we do that is we take it off of Schedule 1, we decriminalize marijuana so the states can choose how they want to implement their legalized cannabis laws, and and keep the Fed out of the state's business.
All right, we covered a lot of ground. We want to thank Kendra Fershee. She's the Democratic nominee for the congressional seat in the 1st District here in West Virginia. Kendra, good luck to you on Election Day. Thanks for joining us. Interesting conversation.
Thank you.